What is PRP treatment? It stands for platelet-rich plasma. It is a licensed treatment that is proven to work for androgenic alopecia. So that's both female pattern hair loss, male pattern hair loss, as well as shock loss, which you see with all patients. So who is PRP very good for? It's for the patient that doesn't want to take some medicinal forms of anti-hair loss medication. So for example, if you're a male and you don't feel like you want to take Propecia or finasteride, you haven't seen great results with minoxidil, and also if you've had all reversible causes of hair loss investigated. So for example, in female pattern hair loss, if you have low iron, low B12, low vitamin D, as well as hormonal issues, this may affect your hair in a negative way. Improving these factors may even require you to not even need PRP treatment. This is something that I see in clinics all the time. People come for very invasive treatment options, sometimes even things like hair transplants, but actually they've got a medical pathology that they can reverse their hair loss. So the most important thing to do is reverse all of those causes before, and also see if simple medicinal forms help you. If you need a little bit more help, or if these things haven't worked so well for you in the past, this is where PRP steps in. It's approved to work in both male and female pattern hair loss, as well as shock loss. I commonly use it in my surgeries, as well as after my surgeries for such indications as well. Here at Dr. MediSpa, we also perform at the same time, included in every platelet-rich plasma treatment, platelet-rich fibrin, which is a more longer acting stimulant that can also stimulate other growth factors that PRP cannot do. It just makes for a more effective treatment. I don't believe in just offering PRP when the evidence, the medical literature states of the benefit of using platelet-rich fibrin in combination. And this is something that you get exclusively at Dr. MediSpa. How is the treatment performed? Well, the treatment is performed in office. A sample of blood is taken, the red blood cells is then separated from the plasma. You've got platelet-rich plasma as well as platelet-rich fibrin. This is extracted from the tubes and then injected with a very fine needle under vibration. Using vibration, it really does help the process, and it's over very, very quickly. Injections protocols take anywhere between 10 to 15 minutes, so you're not in pain for so long. How many sessions? I generally like to start with 4 sessions. 3 sessions, 4 to 6 weeks apart, and then the 4th session can either be another 4 weeks apart, or if you've got good results, then I extend that. After that, you must realize that you have to maintain your results. With PRP, the studies show that you get efficacy of up to a year after your last treatment. This is why my protocol that I've used for years works very well for my patients. You do those 4 sessions, and then as a maintenance, you have a treatment quarterly. If you have fluctuations in your hair loss, i.e. stress, or your genetic code means that you're going to suddenly lose more hair, you may need closer treatments. So think about this about hair loss. You're going to lose hair like this over time. If you do things like PRP and other types of anti-hair loss things, it can happen like this. The overall curve is going to be down, but you have to maintain it. At best, you get some great hair growth, but you still have to maintain that. At worst, the descent is not as marked. So this is really important to remember. It's not a one-stop cure for your hair loss. At the moment, at this space and time, we don't have a cure for hair loss, but these things really do help slow the rate down, can grow some hair, and you can get some great results.